Welcome to Skyscape's free webinar series. Today's topic is how mobile tech can slash rehospitalizations and boost HCAHPS scores, transforming healthcare for the better. I am Kristen Snowden-Smith from Skyscape, and I will be the moderator of today's discussion. This discussion will be recorded. Joining us today are Josh Simpson, VP of Clinical Operations at Summit Home Health and Hospice. As you can see from his picture, he's happy to have mobile technology that he can take wherever he travels. Thank you, Josh, for hopping off the bike and spending an hour with us today to discuss the challenges and successes you've had at Summit with mobile tech and telehealth. Ted Antkovic is a Chief Product and Customer Officer at Skyscape. He's just as excited to have mobile technology at his fingertips, whether he's biking on the trails in New England or buzzing with his sons who practice in Chicago and Boston. The partnership between Summit and Skyscape could be best described as a prescription for success. Before we get started, Josh, could you tell us a little bit about Summit as an organization?
Absolutely. And thank you for having me on the call today. So Summit Home Health and Hospice has been around for 15 years. We're about a medium-sized agency located on the Wasatch Front in Utah. We service around 150 to 200 home health patients at any one point in time, and our hospice census is between 80 and 100. Summit was started by a team of two nurses who are married, and our third owner is kind of the business development man. And they branched off from a larger organization with an idea in mind that they wanted to focus on an organization that really focuses on the three pillars that they believe creates a successful agency, which obviously the first is your patients, the second is your employees, and the third is the referral source. Yeah, so we've been growing over the last 15 years, and these last few years as we've been innovative in the field, it's been exciting to see where things are going. So thank you for having us.
Thank you for joining us. Ted, why don't you go ahead and tell us a little bit about Skyscape?
Oh, wow. Thank you so much, guys. Welcome, everybody. Look, before I do that, before I tell you our story, let me take a minute and just say thank you to all providers, clinical and non-clinical, for all your hard work, all the commitments and endless dedication to patients' care during this extraordinary, difficult pandemic times. And listen, also, so you feel, that you're not alone over there. Please rest assured that, we at Skyscape as a team, we are quite frankly pulling all the stops, working around the clock, around the globe as well, to provide mobile communication collaboration solutions that truly enables patient cutting edge centric care. So that's how we arrive over here, and we are pleased to share this experience with one of our incredible customers from the West. So let me tell you a little bit about Skyscape. Although the story is long and I could take probably more time than Christine would ever allow me, but let me just tell you, I mean, we as a company have a long history in healthcare. And the immobile healthcare specifically. As a matter of fact, one of our founders was the first to deliver mHealth applications in the marketplace over 25 years ago. So with that incredible depth of clinical knowledge and experience, we have started to build BUS, clinical communication collaboration platform years back, and platform that is truly designed by clinical providers and for all providers, which is totally unique in the marketplace. No one out there can make that claim and deliver on that. So that platform really truly is able to meet today's challenges. Although the challenges are extraordinary, we have something special to offer. Always purposely developed for healthcare, fully encrypted end-to-end and HIPAA compliant, full multimedia capabilities. You're going to love what you're going to see in a minute. And remember, please, we haven't adapted this platform for healthcare. We are laser focused on clinical space. Christine?
Oh, I'm here. Sorry, got a little ahead of myself. Thanks, Ted. Josh, this
Sure.
isn't your first time implementing a communication systems. Can you take us back a couple years, if you choose, before you implemented patient-centric tech?
Oh, that's a lot to remember to go back a few years ago. Me and my staff were actually just talking a couple days ago about how things worked before we implemented a platform that allowed us to communicate this way, because it's hard to even remember how we functioned without it. But you don't know what you don't know until you have a platform that you have to implement. So, there were some nightmare stories, and I think anybody that's in home health can agree that one of the biggest challenges we have is not only communication, but real-time communication, and how important that actually is. How many times have you had an aide that continues to go see a patient for a week after they've actually been discharged because the aide didn't get the note that the patient was discharged? Or, even worse, somebody goes to see a patient that passed away, on hospice the night before, the next morning, because they weren't aware that they had passed yet. And those are just a few of the things on an internal level that we used to really struggle with, that we don't struggle with anymore. But yeah, I mean, the depth that this type of a platform has changed our day-to-day operations has just been incredible to see. So, really, like I said, I can't even remember what things were like before, when we were having to pick up the phone or hoping that we would get something communicated to us, and maybe it was days or weeks later.
So definitely a system that has saved you time, as well as given you an opportunity to provide better patient care across the.
Oh, yeah, absolutely. The time savings, at first you don't think maybe it's going to save you time, because if you implement it in the way that we have, it is integrated into everything we do. Everybody in the office has WeBuzz on their computers, and there's messages coming and going all day. So you would think at the beginning that maybe it's not going to save you time, but to have that communication in real time, in the end, it saves you so much time. And the nurses, and all the clinicians now, not just the nurses, even our contract therapists, they ask to be in the system if they're not in it yet, because it makes that big of a difference.
Basically keeps everybody in the loop.
Yep.
So you had quite a list of requirements for choosing a solution. Can you share with us the ones that Buzz checked off your list, when and how having a system built for healthcare setting is better than having one that was just adapted?
Yeah, so I think for us, before we found Buzz, we had the opportunity to work with multiple vendors. We've been doing this now for about almost 3 years, since we really started looking and implementing a platform. And we have a platform. We had a platform that we found, that had a lot of features that we really liked, and we were able to develop our protocols and our policies around that. Unfortunately, that platform abruptly shut down, and we had a 2-week notice to find some others. I couldn't, we couldn't find anybody that had the things that we needed. So unfortunately, we had to choose, a vendor quickly, because our processes are such now that, not having a platform like this would be very disruptive. So we did choose a vendor that made a lot of promises. And we gave them about a 6-month window, and they just couldn't come through on those promises. So, we had to move on, and thankfully I found Buzz. We had a phone call with Buzz, and really just very straightforward, told them the things that we needed to have. This program, it has to be HIPAA compliant, first of all. We all know that, but it also has to be easy to use. If we're going to implement something on a level of this nature, and with a team that already had something in mind that they knew worked well, and was currently using something that didn't work well, to disrupt their day-to-day and implement something new, it needs to be easy to use. So if it's not, they're not going to use it. It's got to be, you got to be able to add people to those threads so that they can see the information before. That's something that no other vendor that we trialed could deliver for us. And in home health and hospice.
in a situation where you added an on-call person who may not have been part of the care team, but now because they're covering for someone, they need to know what's been going on, and being able to do that and see the history of this patient is key.
Yeah, absolutely. So with home health and hospice, you have, we have 90 employees or so, and within the system, we actually have about 210 now overall users. But people come and go. So you might have a patient that's being seen by their care team, but somebody's off, or there's an on-call situation where you got to send someone in. And you can give a verbal report, but we know in the real life that doesn't happen as often as it really actually should. And so to be able to add them so that they can actually see the conversation that's been going back and forth is huge for them, because they're not walking into this blind. They know what's been going on.
And they can provide better care. So was there
Yeah.
anything on your wish list that Skyscape has delivered since the implementation?
Yeah, absolutely. So I would say the biggest thing has been telehealth. So being, with COVID hitting us, we all of a sudden were faced with huge changes. How do we deliver home health and hospice care to people in their homes when they are scared to have you coming in there, or when the facilities are closed down because you can't get in there? So I mean, immediately, CMS issued some rules, saying that you could do some telehealth, but you had to have video, and that's something that we didn't have access to other than FaceTime, which isn't HIPAA-secure. So that was something that we reached out to Buzz for, and I gotta say, I mean, it was a matter of not even weeks before they had this platform delivered to its users, and it's been extremely useful for us. And so that's probably the biggest thing that they've added. The ability to make Buzz phone calls has been huge. Patients get our cell phone numbers because we're calling them all of the time. To be able to call them right from Buzz and have Summit's office number show up on that patient's caller ID, and it protects that staff member, from boundary issues, and lets them have their privacy still if they're using their own phones. Electronic health record implementation, that's something that is huge that Buzz has been able to deliver for us as well. In addition to some of the things I've already talked about, like the sharing of, messages with people that we add to the groups. You used to be able to add to the thread, but you couldn't share those, and that's something that we needed to have happen, and Buzz was able to deliver for us.
You also had a request for digital document signatures. For what do you use that more for? Onboarding?
Yeah, so the ability to, Buzz has a lot of features, a ton of features, but one of them that we utilize a lot is the ability to send documents to each other. It's actually almost eliminated our use of email within our agency, because everything just goes through Buzz. But one of the things that we all have to do is onboard new patients, and and sometimes even with orders, if you got to send an order to a physician and you need it signed really quickly, to have a platform where you can have that PDF and click on that and open it up and electronically sign that. That just makes your admission process go quicker. It allows you to get those orders in much faster, and overall your patient care is going to be better, and it has been better. So that's huge. That's probably just as big, if not bigger, than telehealth, being able to offer that.
So as it's a collaboration tool, and you've talked about how it's secure, it saved you time, efficient communication. Can you walk us through the intake of a patient and how Buzz streamlines the process when building the care team of staff and external providers?
Yeah, so we've developed our intake process over time. When we first thought of what we were going to do to meet the requirements of the ACO, which is an accountable care organization that we're a part of here in the state, one of those requirements was that we had a tool that we could communicate very well, and most of the ideas that were coming out were things like, let's do a spreadsheet every week with some updates on it, or every different facility has its own form that they want you to fill out, and that's not time effective. That's not going to work well for most agencies. It takes a lot of time. So we have created a situation where with Buzz, every single one of our patients has their own thread or their own group, and it's titled by their last name, their first name, their date of birth, and their attending physician is on there. And we communicate everything that has to do with that patient through referral of care all the way through post-discharge, following up with them and new admissions, all on that same thread, so we can refer directly to that. Our process is such too that we also utilize internal groups. So we have a variety of liaisons in the field, or marketers, and every one of them have their own buzz group. And this group they can use to deliver new referrals right directly into the, to the intake team. But they're also notified of new referrals because they don't always know when they come in. So for instance, one of our liaisons, we'll just call her Abby, she has her own thread, and when she knows the referral's coming in, she'll say on there, patient Jane Doe is being sent over from Dr. Branco, and watch for that. So the intake knows that it's coming, and then they'll watch for it to come, and once they receive it, they notify back and let her know that it's here. That way, she's aware that it's here, and she can notify the physician's office that we do receive it. But on this thread, we have our intake team, which includes the director of nursing and our insurance authorization reps, as well as the marketing team. And so they are able to identify, is this patient appropriate to take, and then also, can we take them? Can we take their insurance? And then once we identify that, yeah, we're going to take this patient, that's when they create that patient-specific thread. There's different steps that we go through the intake process. So once the thread's created, it's generally just the immediate team. So the director of nursing, the case manager that's going to be taking the patient, the insurance rep still goes on there as well, and the marketer. And there's some communication that goes back and forth there as far as, this is their insurance, they're going to have this out-of-pocket cost, they're not going to. These are the things that you need to be aware of. Our director of nursing actually sends out a pre-admission summary on the thread so that the team can read, why did we get the patient, what's their name, what's their situation, is there anything that they need to be aware of immediately, like this patient needs INRs done, they're taking Coumadin, so we're watching to see for bleeding precautions. They need their TED hose, the little things that sometimes get overlooked, we're making sure that those get communicated up front. And then once the care team is actually identified completely, so the therapist, whether that's a physical therapist, PTAs, occupational speech, CNA, anybody on the team, they are added into that group so that they have real-time communication. Once the team goes out and sees the patient, so the nurse does the admission, the therapist does their evaluation, we have templates that they're required to use, so they update immediately before they leave that patient's home with a quick little summary of how the admission went. Is there any issues with med reconciliation or anything that the team needs to know about? Does the physical therapist who's usually visiting the same day or the next day, do they need to know anything before they walk in? And they've got it before they ever get there. So it's delivered to them real time. You can see who read the messages. So there's an accountability feature there to make sure that that your team is actually paying attention to the messages. But I can't stress how much this has been able to improve that overall communication, and it makes your patients really know that we are talking, because when the physical therapist comes in and they already know everything that went on in that nursing visit or that nursing admission, wow, they actually talk to each other. That's not something that used to happen. It used to be patients are telling us stories multiple times, because they have to tell their story over again, where now we already know a little bit about what's going on. So, and that thread continues, like I said. Any updates, if there's changes of condition, if the on-call nurse has to go out, they're added to the thread so they can leave a summary of why they had to go out. And then when they discharge, they're all required to do the same. So nursing discharge, what's the status of the patient? PT discharge, anybody that's in there. And that lets the team know, hey, that the patient's discharged, so stop going to see the patient. And it also gives us the opportunity to refer back to that summary when the patient comes back to us again, which happens all the time. So we'll get a referral.
So buzz threads are never deleted. So why is that important to Summit?
It's important because you're not always going to have the same clinicians in there. Sometimes you have clinician turnover, or sometimes somebody maybe is full. And so 2 months from discharge, if that patient needs to come back on home health again, you pick up again from where you left off. And those clinicians can see that summary for discharge and walk into that patient's home knowing really what they look like before, when we discharged them, and identify where they're at now. So these things can be done using the electronic medical record, but you've got to go into the record and you've got to open notes and things to see it. Where with Buzz, we've really turned it into, it's an alternative to picking up the phone and talking to somebody, but it's all right there on the thread, and it's really just become secondhand to us now. It's just day-to-day operation.
And it puts the provider in the driver's seat too, right?
Yeah, so that's, and that's another piece I think we'll talk about here shortly. But our groups don't just have our employees in them. We've been able to bring community partners into this. Well, like I said, we're part of an ACO, which is an accountable care organization, and it's a group of a large number of our biggest clinics here in the state, and we have 3 or 4 different people that are identified that work within those clinics who, if it's a patient associated with that clinic, they're on the thread. And the thing about that is that they're updating the physician and they're updating their records with all of this information that's going back and forth. And that has allowed us to completely eliminate the need for spreadsheets. We don't have any spreadsheets that we're sending weekly anymore. We don't have to have all the facility, notes or weekly updates that we're sending in. And honestly, those were no good, because a weekly update giving them something next week for what happened this week tells that doctor nothing about how the patient's doing today. And we use that with nursing homes. We use it with directors of nursing at different facilities, and and as a referral source option also.
Great. So we all know that telehealth has become essential in providing healthcare during this pandemic, especially in the home care and hospice environments, since they're shut down from outside visitors, and this probably will continue in the near future. So how has Buzz improved collaboration between your organization and the external providers, as well as allowing better care for your patients?
Yeah, that's a good question. So we've gotten pretty creative, actually. There's about 3 ways that we're really utilizing telehealth right now. The first is pretty obvious. It's the patients that are at home that need us and maybe are nervous to have us come in. But and I have to say, the one thing, because I've used some other telehealth platforms that are not user friendly enough for our population of people. We have, our general population is over 65 years old. Most of them didn't grow up with electronics. And I've had platforms where you have to send them a link and they have to download an app, and they're not going to do it. You don't have people that are participating in that because it's too hard for them to figure it out. Buzz has been able to, you can just put in somebody's phone number and they get a text message with the link. They click on the link and they're in the chat, and it can't get easier than that. So being able to do that with our patients and their families in the home has been huge, and it's HIPAA secure. So, you could use FaceTime again, like we said, but it's not HIPAA secure. But we've also been able to use it for our facilities that we can't get into. As an agency, we've really struggled with figuring out how do we continue to care for our patients in a way that is sensical and is meaningful when the facilities won't let us in, except for once every 15 days or once every week. So utilizing this application we FaceTime either with the patient through Buzz, or the nurses actually will do it just directly with the nurse on the floor and give us an update on how that patient's doing, but then we can still see them and have contact with them. So that's been huge. But then also using it for the patient's benefit. So being able to go in there and see that person and then call their son and have a Buzz FaceTime visit with them right there at the bedside, so they can see how they're doing and get a report from us. And that's been huge for them. It's very hard. There's not an end in sight for this. And as far as the facilities go for opening up, I don't think we'll see them open up anytime soon. And, unfortunately, these people are stuck in these buildings and they aren't getting to see their family. So that's been a big deal. On home care, we got pretty creative. We had a liaison that had some interesting ideas, and it worked out really well. And that she identified that there are some physician offices out there that don't have mobile, they don't have the technology to do this. And all of a sudden, in Utah, at least, we saw about a 30% to 40% decrease in the number of clinician visits. People aren't going to the doctors anymore. They're scared to go out. They're supposed to stay home. So physicians can do FaceTime visits with them now. They still need to be in touch with their doctors. And how scary is it to think of this aging population not seeking treatment? We've even seen here in the state of Utah, overall, our emergency room visits are down. People just aren't seeking the care that they really need to have. So we've been able to partner with some of these doctors' clinics that are still kind of in old school style. Yeah, pretty much. To be able to go in there as a home health agency, and right now it's good to do this because the homebound status is being met because COVID is out there, and Medicare has allowed that to be a reason to be homebound. So we've been able to go in.
It's not tied to like FaceTime. I mean, obviously, if you were to use FaceTime, you would have to have an iPhone, and I would have to have an iPhone. But with Buzz, you can have an Android device. I can have an iPhone, and we can communicate. I mean, a lot of elderly people tend to have Android devices, so being able to communicate like that is a huge plus.
Yeah, for sure. So just to quickly finish that up, so what we've done is we've partnered with some of the doctors in our town, in our service area that don't have the technology, and so our nurse will go in to admit the patient to home health. And while they are there on the admission, they will do a Buzz FaceTime call with the physician. So the physician can see the patient and they can bill for that. So that's been a big deal for them to be able to, that's incentive for them, but they're still treating their patients, and those patients are getting the care that they need. So, those are a few ways that we've used it. It's been a big deal.
Yeah, so the care can continue and the practice can continue making its money, right?
Making its money, but also not having these patients sitting home becoming deconditioned, not having their meds. I mean, people run out of meds, they stop taking the medications, and then these chronic conditions that these physicians have been trying to manage for years, and all of a sudden it's all out the window because they can't see them anymore. So it's a big deal.
Seeing is believing on how somebody's doing well, right?
Right.
So, Josh, since implementing Buzz Secure Medical Messenger, Summit has decreased its rehospitalization by 50%. So in these current times, we know rehospitalization can mean time quarantined away from family, and this is huge. So can you elaborate how your team uses Buzz to get these results?
Yeah, so I think anybody that works in home health knows that now you've got to keep your patients out of the hospital. We got a head start on this as being a part of the ACO that we're a part of, and really had to buy into that vision early on that home health can't be the way that it used to be. We can't just send them back anymore. So we've adapted our use of Buzz to include our community partners who are going to help us with this mission. Particularly talking about our directors of nursing in the facilities, or our facility partners that are directly in charge and interested in keeping these patients that leave their buildings and come to us out of the hospital. So right away when we get a patient, we identify how many days do they have left of their skilled benefit at the nursing home, assuming that they've been at a nursing home. So this is kind of one category of patients that we deal with. But most of the time now, with PDPM changes last year with the nursing homes, and PDGM changes with home health now, they're not staying at the nursing home very long. They got to try to keep the cost down, and so they're sending them home. So usually you're going to have a 30-day benefit still, or a certain number of days. So it is our goal to keep that facility in the know so that they know what's going on with the patient. And if they start to fail, it's interesting to kind of see how you can catch that from the threads, and you can start to see this is happening. But we can immediately get their attention on the thread and say, hey, this patient is probably going to need to come back to the facility because there's a number of things that they're going to have to do on their end to make that happen, including getting an order. But they're involved from right there. So, we stop the cycle of them failing at home and going back to the hospital because we catch it and when they're starting to fail, and we get them back into the rehab where they can have a little bit more aggressive rehabilitation and 24/7 nursing. So that has helped us a lot. Another area that we've been able to make the biggest impact is keeping the physician in the driver's seat. 5 years ago, or even 3 years ago, the doctor wouldn't even know if a patient was on home health most of the time. So you'd get a patient's referral from the hospital. They're coming home from the hospital, or they left the nursing home, and the nursing home's doctor wrote an order, and we'd put the 485 together and we'd send it out, and they'd get that and they'd sign it, and they wouldn't have much more interest in it than that. But the problem in that came from when patients start to fail, or when they're having issues at home with their medications, and the doctors don't know about that. So your nurses are trying to get a hold of them, and they want to see the patient because they don't know what's going on. I haven't seen them in months. Well, this has really eliminated that for patients whose physicians have representatives within our organization in Buzz. They know what's going on with the patients, and so we can get what we need for them. This has been huge, all the way down to my nurses used to have to, and I remember as a case manager for me, having to call the physician's office because I think that my 80-year-old patient has a urinary tract infection, and having to leave a message with someone and hoping that within the next 24 hours I'm going to get a call back. Well, by that time they're in the hospital again, so
Josh, how do you, when you're adding, you have your known people in your agency or whatever. So when you want to have an outside provider join Buzz, how do you engage them?
We just have a conversation with them. So our liaison team is primarily in charge of that. So they've all been trained in Buzz and how it works, and they will have a conversation with that provider and show them Buzz on their end. We have a little test thread set up in Buzz so we can show them kind of how it works with a fake person. Mm-hmm. And then they'll send them the invitation. They let me know, and I'll go in and add them to the organization, and we add them to the patient threads and share the information with them.
That takes you what, just a few minutes, right?
Oh yeah, it's a matter of maybe 2 minutes from start to finish to get the whole thing taken care of.
Excellent. That was a question from the field, so.
Oh yeah, perfect. So. Well, just to quickly just finish my thought.
So happy to see the field engaging here. Keep it interactive because it's really opportunity for us, for all of us, to learn from the best. And quite frankly, I mean, I've seen it all in every setting. And I got to tell you that Josh is at least 2 years ahead of everything what I have seen in terms of a mobile healthcare customer patient-centric delivery system. So take the opportunity.
Thanks, Ted. I would add to that it's very easy. They're not confused when they get the invitation from you. So when I'm adding somebody new, I can do it from the office, just from WeBuzz, which is on my desktop, or you can do it from your phone. But they actually will get a text message or an email from you. So when I send it to them, it comes from me. It says my name on it, so that they're not getting some random message and they don't know what it is. And then it's just a matter of clicking on the link. They get a little code that they're going to put in once they open that up and download the app or put it on their desktop. And then once they're in, I actually get a message sent back to me from them. That's an automated message just saying, thank you for the invitation. I've downloaded the app and I'm now using Buzz. And then from there, there's 2 steps. I have to go into my organization and I just add them to the organization itself. That is what makes it HIPAA-secure within our little group of people. And then it's done. So they're in there.
Excellent. So we know that teams can be in the office, out in the field. So we have the Buzz comes on both mobile, Android, and iOS, Apple devices, as well as any compatible web browser can be used. As you mentioned, you use it.
It'll be very, very exciting to see what that looks like once it comes. I'm excited for that.
Yeah,
Great,
we have
any
some
other
other questions here, Christine. Do you have others? Because I see them coming on my thread.
I see them. Question from the audience here: is your intake part of the groups? I don't know if you can answer
Yes.
that based on that question. You might have more knowledge.
Yeah. So our intake team, for us, our intake team is comprised of a nursing supervisor or the director of nursing, and then one other intake coordinator and our insurance rep. But they're always on the initial threads, and then the intake team is actually responsible to start the patient specific thread, and they are on it all the way through.
Excellent.
Yeah, go on. I think you have more questions. I see them coming here, Christine. So, you know.
Hello.
Oh, John, hi.
Yeah, sorry about that. Something went wrong with the microphone. I apologize.
Oh, Mr. John, you know, you're having too good of a time out there in Arizona. You know, we gotta get you here to New England faster.
Yeah, I appreciate that. I'll be on the next flight over.
Wonderful, wonderful. Do we see his video? Do we have his demo live?
Everyone should be able to see his screen now. So we'll give the floor over to you, John, and we'll take some questions after the demo too. So go ahead and post your questions and we'll get back to them.
Yeah, thank you very much, everybody. I really appreciate you giving us the opportunity to show you this. And like we say, seeing is believing. So I have my actual live device on the screen here. And I'm signed in as a nurse Arjun. He's a unique nurse. This is actually the Buzz screen, and you can see right when you jump into the screen, you have all the different modalities, all the different ways that you can collaborate with your teams and your patients. And that was the whole idea behind the building of Buzz, was to be able to quickly get in here and start exchanging messages, communications, and everyone be on the same page. I'm going to actually jump right into the chats, and we can take a look at some of the different chats that Arjun's a part of. Like I said, he's a very unique nurse. He's part of art therapy group. He's also does things with patient intake, and also on his floor here. So you can actually jump into the different messages and see what's been going on. For example, this patient here, we have a patient that's with intake here. We have some prescriptions that someone posted on here. We also have a different sample of lab reports on here. When we get lab reports back in, we can quickly post them up here right from our own device, look right through them, see, you can zoom in, see all the different lab reports. We can save them, we can forward them to anybody we want in here. We can even set up a telehealth meeting and events through the actual app itself. You'll notice down below there's some different ways you can communicate by sending a file, perhaps your location, a video. You can even do a dictation and send a dictation to team members on here. I'm going to go ahead and choose a file, get started here, and send a little intake form to my team. So this team will be able to go ahead and start processing this patient when they come into the clinic or your hospital setting. The great thing about Buzz is you can create these groups, you can create these chats right on the fly. Just with a quick couple taps of a button on the screen here, you can create a group or talk with multiple users without doing much work. And I'll just quickly create a group and show you how easy it is. You invite all your members that are part of your Buzz circle, and that's how you know that all these people are securely communicating with encryption. Because once they're part of Buzz, you know all those messages you send back and forth are end-to-end encryption. They're protection keys on both sides, from the user who sends a message to the one who receives it. Let me go ahead and add some of my team members to a new group. We have also groups, people that use for the floor. So for example, this is for a med-surg floor. I'll go ahead and create a group for the med-surg floor. And I've added all these members to the group. So now we can start talking right away. We can start to collaborate. Anything that's has to do with maybe something on the patient, maybe you want to send some information to each other, some images. We'll go ahead and pull up a picture here. We can send in this form for the patient. Now everyone has this form available for them. If perhaps I wanted to start talking to somebody that's available in my group here, I can quickly communicate with them by tapping right on the little phone icon in the upper right-hand corner. This will allow me to go ahead and quickly call anybody. Maybe I want to go ahead and call John and make sure that I have the right form that he sent over, and we can quickly talk to each other that way. There's a lot of different ways to communicate within Buzz. The best thing is the HIPAA compliance controls that are in here. So you can put any users or anyone that's in a group into an organization, and that's going to really help you guys with the HIPAA compliance and different audit controls. I'll jump into my organizations here. Now I'll show you I'm part of a Pine Tree Corners Health, and I can add more users. I can see who's part of my users on my group, and this is going to help you to add more people to a group or to be able to see past messages. So for example, we have our friend, our patient here, who's in patient room 3312. We can open that up and we can start adding people to this group. So if someone wasn't part of this group before, we can add more users. Right from our circle, we'll go ahead and add the doctor. I think the doctor is ready to come into this group. And now that the doctor's been added, we can actually share all those past messages that we have in this group. So now the doctor is available to see all the past communications that were given to this group. And no need to have to go to explain. They're already caught up to right to the minute and being able to see what's going on in the patient in real time for us. You'll also notice that you can also set up not only events, but you can also see video conferencing with telehealth. This actually is a group for art therapy where they not only share their art through the group and through the messaging, but they also can do telehealth conferences right together right through here. I'll go ahead and start one myself real quick. And it's very easy, very intuitive. As we send a quick message to anybody, you can start a video conference with anyone you know. The easiest way to do it would probably be to send them a text message. You can also send them an email as well. And the great thing about it is there's no software to download. So I'll go ahead and send a text message to our nurse who's in the field right now. Make sure she's not too busy. And when I send the invite, it's going to go ahead and send a text message to the recipient. They'll get a nice little click of a link, and that's all they have to do is click on a link, and they'll be able to connect right to the video session itself. So I'll go to my video sessions. I can see all my video sessions that are available. There's our nurse RN. Let's go ahead and start it up. And that's the great thing, right on the fly, just by clicking on one little link, I was able to connect not only to another member of my team, but also his. Oh, hi there, nice to see you, honey.
Uh-oh, you're going strong there, John. Do we know this nurse by any chance?
This is my wife, Michelle, and it looks like there's no codes going on, so really appreciate it.
I don't know if we could hear her through all her PPE, but hi, Michelle.
Hey, Michelle. Thank you for joining us.
Hi.
And come back to New England. You know, summers are better here.
Love you, baby. Talk to you soon.
Cheers.
You can see how easy it was to quickly connect to somebody, and it really was just a link. All she did was click on a link to be able to connect, and that's a great, powerful tool inside here. All the call histories are saved, available for any call you make, available inside Buzz as well, so you'll save that history in there for you for any type of HIPAA compliance or controls that you need to record these conversations for somebody. We really look forward to supporting your team with this with the Buzz. If you want to reach out to us anytime, we are here for you.
So as we were showing you Buzz, we invite you to try it out. The app is free. You can download the Buzz app. Just go to your app store and search Buzz Skyscape. Once you have your account set up, you can also use the web version at buzz.skyscape.com. And if you have any further questions, you can go ahead and we'll take a couple minutes here because we know everybody's time is important. If you have any additional questions, please post them in the chat window.
So I don't know if you have any idea, but I have some coming in. If you want me to share.
Sure.
Yeah. So there's a question here: is there a cost barrier to onboarding third-party partners on Buzz or through Buzz?
Question for me?
Yeah, sure. I mean, why don't you start, and I will second it if we need to align.
Yeah, I mean, there's going to be a cost associated with this. For us, the cost, the benefits outweigh the cost tenfold. So I will say though that the cost of Buzz is significantly less than any of the others that we were using, for a lot more that you're going to get. So one thing that I didn't really talk too much about, and kind of what makes it worth it, is bringing on your third party people, at least for us, has created a kind of a symptom, or not a symptom, but one of the things that it's created that we didn't expect is a referral source tool, and so what started to happen was we were bringing on these discharge planners from nursing homes, for instance, and making it much easier for them to be able to send us documentation. And what started happening is they started sending us referrals right through Buzz, right into our intake team. And so for us, that, I mean, one referral alone would make up any loss that you would possibly have. So utilizing it for all of its tools that it offers, and being able to use it just as if it's a CuraSpan or another referral-based platform, has kind of been a byproduct of this as well. But yes, there are some fees associated with it.
Christine, you have any other questions out there from audience?
One final question to Josh. Do your intake and marketers communicate back and forth on Buzz?
Oh yeah, all day long. So our marketers all of them have their own intake thread, and it's got all of our intake team on it. And anybody that's associated with those marketers, it's back and forth all day. We probably, and these numbers can be intimidating to people, but we probably have 3,500 messages going back and forth every day with every thread that we have. And that's of course as an agency as a whole, but so you're not getting all of those. But we do use it. We use it all of the time. And they still make phone calls. There's some things that you have to be able to talk about on the phone, but our marketers will do needs assessments. They will send in, screenshots of things or PDFs of things right from the referral source when they're out visiting the patient, right into the intake team here in the office, which has been quite nice because it has really eliminated a lot of the faxing that we used to do. Lots of times it's frustrating because you have your marketer run to a facility to help get the paperwork you need, and they slap it in a fax machine and you never get it. Now they scan it, depending on how big it is. Most of our people have the scanner, on their device, and they can just scan it right in and hit a button and send it right into Buzz, and it goes right to our intake.
Excellent. Well, I think we're about at our time, so we will wrap it up here. If you are interested in learning more about Buzz, HIPAA-secure medical messenger, you can go to med.skyscape.com or contact Ted directly at ted@skyscape.com. Ring him at 508-393-7979. Thank you, everyone. Have a great afternoon.